You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
The testimonials appearing in this podcast reflect individual experiences and individual results may vary. Cardinal Health does not claim, nor should the listener assume, that any individual experience recounted in this podcast is representative of what another consumer may experience. The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Calori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts.
All right, RBC 2025, and this is a podcast that near and dear to my heart because I utilize the service all the time, and that's reconciliation. So it's one of those things that a lot of people don't really think much about, I think, in the pharmacy world until it's almost too late sometimes. I have heard horror stories of stores that didn't even realize where their money was going. But I've got a panel here with me today. I got Brad, Kristen, and Lilia. Beautiful name, by the way.
Thank you.
And you own your own store, correct?
I do.
All right, awesome. So we're going to talk about Recon. So let's just jump right in. Any of you guys, Brad, whoever, Kristen, if you want to stop. What is Recon reconciliation when it comes to, number one, what Cardinal's doing, but just as a pharmacy owner, why do I need to think about Recon? What is it?
Well, Cardinal Health Reconciliation, it's a web-based financial management tool designed specifically for pharmacies to help them track, verify, and reconcile third-party prescription claims. It acts as a checks and balances system for your pharmacy's billing process. It ensures that pharmacies are accurately reimbursed for their prescriptions they dispensed and provides a clear, real-time view of their financial interactions with their pharmacy benefit managers.
Yeah. You know, reconciliation, and Kristen, you can chime in here too, like, we do a lot of claims, and it's a lot of money going all over the place, and we have no idea where it's going as an owner. And really utilizing that reconciliation platform, finding one, first off, that's easy to use.
Yes.
That's the big piece,
right?
Lilia, have you used different ones before besides?
Well, I actually did like manual reconciliation when I first opened my first pharmacy.
Oh, you poor thing.
I know, right?
Yeah, that's really tough. I had a lot of years experience in pharmacy before coming to Cardinal Health.
Yeah.
And I did reconciliation for 3 stores. And this was prior to 835 files being a thing.
That's horrible.
So it is very manual. But with a really good solution like Cardinal Health's reconciliation, you have visibility into so much claim detail and the payment information that comes in. You really can hold everybody accountable, make sure you paid for what you're supposed to be paid for, and track on-time payments, late payments, slow payments, any of that stuff.
Right.
It's very important to reconcile regardless of the solution.
Right.
Yeah.
Lilia, did you use any other platforms? You don't have to name them, but did you? One, you're here for Cardinal Health and talk about their platform, which I think is very easy to use. Have you used other ones? You were manually claiming, you were manually reconciling. And then I'm sure, like for me, it was hard and a little bit easier and a little bit easier and a little bit easier, right?
Yeah, so I only had the short period of time that I did manual claim reconciliation, but it was so overwhelming because it's like you want to reconcile all the claims, but then you don't have the time for all the claims. And I just did $500 cut off. Anything above $500, I will just look into it, manual reconcile. But under 500, I just okay, I hope I got it.
Right.
Yeah, that was
how
a period
many
of time.
$1 claims?
There's so many of them.
Oh my gosh.
That's a problem.
Yeah. Cardinal offers a couple different platforms, Recon and Recon Plus. But I like where I can get on the dashboard and it puts it in buckets, right?
Yeah.
Hey, here's your 0 to 30. Well, that's kind of like, how much money do I have out there, really, right?
Yeah.
Here's your 30 to 60. Well, maybe this payer's being dumb, right, and be a little slower. Then you get those one-offs that are way out there, and that's where you guys kind of shine and you come in. And so talk about the difference between Recon, Recon Plus, and how you guys can help us find those claims and maybe get that money back on something that's just way out there that's 120 days plus getting paid?
Yeah, I would say, so I want to take a step back really and say, really more than anything, when I think about reconciliation, it's holding PBMs accountable, right, and making sure they're actually paying. But as we look at the different solutions that we offer, regular Recon, we're giving the tools necessary for a customer if they want to do their own reconciliation, which is fine. But I'm a big believer of Recon Plus, and I think one of the reasons for that is because I think there are a lot of claims that get paid, but they don't get fully paid. They're either underpaid or overpaid, which actually creates a payment exception. And that's where analysts can really dig into helping you kind of close the gap and finish reconciling the actual total claim amount that goes into that. There's just so much that goes into it. Not only that, but the big focus is looking at those claims that are aged out over 60 days that are still open, having that discussion, and making sure that you continue to have those touch bases because those are important. Communication is key to make this successful. But not only that, they help with paper EOBs, right? So you don't have to manually create a paper EOB. They'll reach out to payers for claims that have aged out over 60 that haven't been paid yet. And that's why you have those conversations.
Right.
Are you expecting payment? No, it's just, I reverse this claim out, I'm not waiting for payment on this.
Right.
And again, we have customers that say, well, what's the ROI? What's the ROI for being on the solution? Well, it's your time.
Oh, man.
You know what I mean?
A lot of people don't realize that.
Yeah, it's your time. And they always say, well, I know I'm going to get paid. Well, it's not just about being paid, and it's not a collection service. There's so much more that to it. It's how are you doing as a business? Where are you growing in terms of the payers that you're doing business with? Where are you seeing a drop? Are you losing patients somewhere? I think, and then also that the reporting capabilities are really good too. Yeah. And if you have questions, you're not really sure, that's why your analyst can really, really help you. Right. Not only that, but something they've done that's a little different is each analyst has their own Candy link. It's a link that they can use that customers can click on, and it gives days and times that the analyst is available.
Nice.
And they can do it through either a phone call.
I'm glad you guys are doing that because that was one thing years ago that we always kind of had trouble with. Everybody's so busy.
Well,
you'd email.
Well, you call 1-800 number, or there's a GMV email that you use. But now, because they'll say, hey, I'll give you a call next month. And okay, great. Well, they'll call, and the pharmacy's busy. Like, oh, I can't talk right now. Can you call tomorrow? And then that's when you can, at times, that communication. That's where you have communication barriers. So by being able to actually schedule a day and time, it allows the pharmacy or whoever the Recon champ is to set aside that time so they can focus specifically on AR health and making sure that they're in a good place. And I think as long as they do that, that's the most important piece.
Yeah. Lilia, tell me about your experience with Recon and how you feel like it's been an advantage to you in your business now.
So I'm using the Recon Plus.
Yep.
I currently manage 11 stores reconciliation.
Dang, girl.
It's not bad, actually. It's pretty easy compared to the manual day, right?
Hold up. Do you own 11 stores?
Part owner, yeah.
Look at you.
Thank you.
Nice.
It's impressive.
So basically for me, I think the best part I have one analyst for all my stores. So whenever she emails me, she just basically do NCPDP number and then tell me if there any actions I need to take to help with the Recon. I always set a goal with my analyst that I want my AR to be under 60 days. Everything over 60 days plus has to be 0. So they always reach out to me once a month. They call me. And I set the time. I think that's the part is really good I like, that you can just tell them what time you want them to call you.
Yeah.
So usually it's like 8 a.m., it's like Pacific time. So my pharmacy is not open yet. So I'm able to answer the phone call, talk to them for sure. I don't have to be like I'm in the middle of the work, right? And talking to the patient, I couldn't have time to talk to them. And also they send out a summary email to me every month and try to basically clear out everything I have outstanding. I really like that. So at the end of the month that at beginning of the month, I print my report on the 3rd month's end report. I give that report to my CPA.
Yep.
So I make sure that my financial looks right. I think as a pharmacy owner, you want to spend your time on building the business, not so much time on paperwork, matching the claims.
Yes.
Honestly, that's not my passion.
Speak, girl, preach.
So I really like the Plus system, the service that you guys provide, because someone's helping me, and the back end was everything. When I have a question, I reach out to them. And the one thing Brad was mentioning is about communication, right? You want analysts to work for you and help you with Recon. You also have to respond to them fast enough to get them the answers.
You have to do your due diligence.
Yeah, you can be
well.
like, I want you to respond to me, but when they ask a question that they have to wait for 7 days, then you only have like 20 plus days in a month, Monday to Fridays, to help you. They can help you to clear the Recon. It's not easy.
Right.
So I think the key is definitely communication and set your goal, your expectation with the Recon, and they know. So when they know all my expectations, they don't really have to call me because they know what I want. They just email me once a month. It's very easy.
Yeah, so
that's perfect.
One of the things that I did at my store with my Recon is my store manager, I tied an incentive into her clearing out and making sure all my reconciliation is done. So she watches it for me. She meets with or talks with our analyst. And if something gets to that 60-day, 90-day mark, which never hardly happens now, then she's on top of it.
Yeah.
And like, hey, I'll incentivize you to chase that money and help and work with the analyst to find it and what's going on, because it's just money out on the table, right? So you having a person that does that with your 11 stores too is a crucial part. Like it's a whole team effort. Like
Definitely.
you have to be understand it's part of the team.
Yeah.
But what I'll say with that is it sounds, for people who aren't using it, it might sound overwhelming. It's not. Okay, you got a team that's working on chasing your money. Well, you could be doing it by yourself, or you can just not care. And then who knows what's going to happen? Because me and you both have found where we didn't get paid,
for sure.
or something was way out there, and you're like, "What's going on?" Oh, well, here it is. And and there's a lot of stores that have money just sitting out there that don't even realize it.
Exactly, and having somebody who is watching your account for things like that, the quick time that you can spend just reaching out before it's too late. What my experience in pharmacy, there's been checks mailed to the wrong store.
Yes,
and having
especially
somebody
in
watching
a new store
that.
or one that you bought from somebody, and you have
Yes.
that switch over in PSAOs or whatever it is.
Yep.
There's this weird time there that if you don't have somebody on your side helping you, it could be very, very frustrating.
Yeah, and having your analysts keeping an eye on that is very, very beneficial.
Yeah. So one of the things that you have on here is Recon ledger enhancement. Tell me a little bit about that. What does that even mean? I know that's something you guys wanted to talk about.
Well, the biggest thing with the ledger enhancement is really less manual intervention. That's the biggest key.
Good.
And then also not only that, but system, like better system performance. Because there are situations where you have multi-store groups and they're trying to pull reports, and sometimes it takes a while.
Yeah.
And in order to assist with, providing better performance within the solution itself, is you got to remove data where maybe it's not necessarily needed. And that kind of leads to ledger. When we're looking at specific claim details, they're tying in specifically to that claim. So you may have 5 or 6 refills on the same claim, but I just want to look at fill 3. And it specifically will look at the drill down tied to that fill in itself. And also when we get a payment, it's actually going to show up as a parentheses, and it's going to be deduction against the amount that's actually due. So it's just, again, it's with accounting practices, and they've been asking for that, and we're here to deliver.
Well, and that's good to hear, and I'm sure you can chime in on this too. I feel like over the years, so I've been part owner in a store for 17 years, 15 years, something like that. And I've kind of seen how reconciliation has grown. And that was one of the big things is, I can look up reports and I can see what my money is, but I still can't even understand what it's really saying. And I do feel, and I'm glad that your guys doing it, you see that, you understand that it needs to be more user-friendly, accounting-friendly, because our accountants are tied into it.
Yeah.
If you're not giving your accountant access to your Recon, you need to be, because they need to be having all that information as well.
Yeah, and they have specific ways of looking at
exactly
things. And we need to present it
the way that they exactly.
Yeah, and instead of the pay reverse transactions rolling up into one net line in the end, it's going to match line by line. So let's say you filled a prescription towards the end of the month, and the payment comes in at the first of the month. You don't want to wait for that payment to match to that net in the end. You're going to want to account on each month what the in and out was for that money. So the ledger is going to allow for that line by line reconciling.
Yeah, and there's a lot of, I had a pod yesterday with an accountant that's big in the pharmacy world, and with the new Big Beautiful Bill, a lot of pharmacies are going to be switching to cash from accrual. Well, your accountant needs to know that. They need to know how to read that off your reconciliation, what that means. So that's a big piece to make sure that those accountants are tied in or so forth. So what other things do we need to know about Cardinal reconciliation that we haven't hit on yet?
Yeah, something too I can mention as well is partial payments. Okay?
Yes.
So current state, when a partial payment comes in, you'd have to go in and manually accept that partial payment. Well, now as they come in, they will automatically be reconciled, to align with the ledger-based, accounting that we have. So that makes it really, really nice as well. And when you also think about vouchers that come in.
I was fixing to say, right? I hate vouchers.
So to add to that, right now currently we have one variance. Variance is set to either do overpayment, underpayment, and it's really hard. But now you have the capability of using the option of doing both overpayment and underpayment. So when you think about vouchers, right, you have a lot that come in where there's an overpayment that happens. Well, you'd have to go in and verify it, overpayment. Now, since you're able to use both, right, both options of overpayment and underpayment, those will automatically reconcile and go to your go to overpayment report.
Good.
So it just makes things so much smoother because, again, what are we doing? It's less manual intervention that needs to happen. I think it's good for analysts. It's good for us as a team. And I think it's good for the customer as well.
We all, with lack of a better term, do not like PBMs. And we don't like the way that they do things sometimes. And it is so confusing. And that's where, and we hit on it a while ago, that's where reconciliation has come through for me, is because these underpayments, overpayments, vouchers, whatever it is, they almost want to try to trick you sometimes, I feel, right? And so I'm just tipping my hat to you guys for the program that you offer. The theme, it seems like this year with Cardinal, is we hear you and we're constantly innovating, right? And that's a good theme that all these pods and all these people that have been coming in, is we hear what's going on. Mm-hmm. We know you've got 11 stores like you have, and we're going to edit Vantus. We're going to edit reconciliation, RCS, and we're listening to you, and we have to evolve. So I'm glad about that for sure. Reporting is another one, which we kind of hit on that with, reporting for your accountant and so forth. So tell us, like you said, you have a lot of reports that come to you like at the third of the month. Like, tell me what are some good reports that you like? So
basically what I use the most is the month's end report.
Yep.
That will be available on the third of every month. That's the one I basically give it to my accountant.
Yep.
So he will use that. And I think the other one I use the most is the post-claim report that is changed to the ledger, right?
Yeah, ledger transaction.
Yeah, that one I also run the report and export it and give it to my accountant as well.
Yeah.
So these two reports I use the most. But prior to 2025, we had this 2024 maybe, the DIR fees, right?
Yeah.
Those things I actually run a lot of report in the past myself to see exactly how much I got paid. Because you don't know in the past how much I got paid. But that is gone, but definitely
Thank
these two
the
reports.
Lord. That's
I know.
I mean, it's still not 100% perfect, but
it's better.
So much better.
I know, so much better. Before, you don't know how much you got paid. You thought that you made money, but at the end of the day, when you look at the report, you actually lost money.
Yeah.
It's just so bad.
Yeah. I hated that line on my P&L.
I know, right?
Oh my gosh, that was a terrible line. Yeah. But okay, so we got updates to Recon, Recon Plus, which we both recommend.
Yes. Definitely.
You get that analyst. You can set times now to talk to them. You need to be reconciling your claims, right? Even if you're doing 50 claims a month, I feel like you can try to chase it yourself, but it's so time consuming. And I guarantee you don't understand 100% what you're looking at.
Exactly. We're not a professional.
You're
for
right.
This.
Yeah. You're right.
It's so hard. Like I mentioned earlier at the product talk, I don't know who to chase at the PBM level, right? Who am I supposed to email?
Who do I call? I got to email CVS.
Yeah, I have to email CVS, but you don't know which email address is the right one to get claim detail.
Which, funny story, I randomly got a phone number to a CVS analyst person one time. I don't even know how I got it. And they were so mad that I called them.
Oh my God.
So mad. And but I just kept hounding them, baby. It was I let them know.
They didn't tell you to work with your PSAO?
No. They don't care what we do. That's a whole nother podcast, right? Right.
Oh, yeah.
Okay, so we've kind of hit the high points here. Is there anything that I missed that you guys wanted to talk about with Recon?
Well, I guess one other thing I want to mention too, as it relates to the ledger, is the rematching. So current state right now, what happens is we may receive a payment file, but we don't have claims data that corresponds with that file to match.
Okay.
So what happens is that's considered an exception. And it could be that we're missing data and we need a historical load that loads in there. Well, when that happens, we have to manually go in there and rematch all these claims. Well, now there's going to be a nightly run that happens.
Nice.
And it's going to refresh. And if there is a corresponding claim that matches with that payment file, it will automatically reconcile. So it's not really something for someone that's on Recon Plus. That's like, woo, but it's really, really helpful. I'm telling you. Yeah. When you are dealing with tons and tons of claims, especially if we need to get historical data, whatever the case may be, they will. The fact to have them automatically reconcile is huge, especially for some of those customers that may be on the self-serve Recon solution. So just having that nightly run, I think even for us as Cardinal Health employees that help support Recon, we had to do that quite a bit for our customers. Yeah. So for that to go away, it just helps us with time management.
And I'm sure in the future too, you guys are going to be implementing AI things, and everybody's doing that.
Yeah,
it's coming.
So my last thing that I would say, and you can chime in on this as well, because if you're one pharmacy owner or more, and you're not doing Recon, we highly recommend it.
For sure.
That's the first thing. Two, it's not 100% easy to start, right? Okay, so you have to understand that. It's worth the time to do it because you got payers that aren't going to be on Recon. You got payers that you're going to have to get the 835 files. You're going to have to do whatever. It is worth the effort to do that. Put the effort in and just get it over with and just do it. So I'm telling you that as a pharmacy owner, and you're agreeing with that as well.
I agree 100%.
100%.
Yeah.
You nailed it. You nailed it.
Yeah.
Because anytime someone starts fresh,
they hate it.
Right?
They're so mad at you.
Well, because like in the meantime, right, before we can get them, like let's say for direct payers, right, before we get them set up, we need EOBs to continue to reconcile those claims, right, which that puts more effort on our customer and what they have to do. So there is a commitment there. And then there's a lot of paperwork that can get involved with that. But once you get through that and you fill out your paperwork and you do what you need to do, it will come together. And before you know it,
smooth sailing.
It's smooth sailing.
I mean, I'll be honest with you. It was so long ago when we set everything up, when we switched back to Cardinal and LeaderNet and all that kind of stuff. I don't even know what's going on. Like my store manager runs it. I look at the reports, but if I had to call somebody or whatever, like it's that easy now because I did spend the time to set it up in the beginning. So I'm just telling all the people out there that are like, I don't know, it's another fee. It's totally worth it. It's a pain in the butt at the beginning. Not Cardinal's fault, PBM's fault.
PBM, for sure.
And but it's totally worth it from there.
But I also feel like with Cardinal, when I'm onboarding my new pharmacies, it's not that hard anymore. They tell you exactly you need to fill it out on the FDS side, who is their contact, what number you need to put on there.
Where it gets hard is if something doesn't actually go through or they can't get a hold of somebody or something. There's some transition issues, but you're exactly right. That person that onboarding is key.
Yeah, it's pretty easy actually. You have to just fill out your pharmacy information, NCPDP, NPI, who's the point of contact, all these things. I don't think it's as hard. Maybe initially there are a lot of paperwork and they have to go through.
Yeah, that's what I was trying to hit at. Is the paperwork stuff can be daunting to some people. They're like, I just don't have time to do it. No. You need to make time to do this for sure.
After that, it's really easy.
Yeah. Awesome. What else? Anything else? I think we hit them all.
I think so.
Yeah, that's a big one, yeah.
That was a good one. So, my last thing, this is the last pod that I'm doing here. It's a good one. It's one that I highly, highly recommend because you need to get every dollar that you have. Don't leave dollars on the table. There are horror stories out there, I know of them, that people have had to sell their store and then all they had to do was make a phone call and they got $400,000 in the bank. And they had no idea.
Yeah.
So those stories are out there. You guys hear them. You know it. Cardinal Recon, constantly evolving, trying to do better, trying to make it cleaner. It's getting cleaner every time I get on there. It's easier. Your analyst is there, and you have somebody on your team.
Yep.
So it's a win-win, right?
Yeah, I think the biggest thing is just listen to our customers.
Yeah.
You know, like that's how we stay ahead of the competition.
Yeah.
Is listening.
Yep.
Ladies, gentlemen, thank you.
Thank you.
This was easy, right?
Yeah, it's pretty easy actually.
Pretty easy. Right?
My first
11
one.
stores, man. Dang, girl. You
Yeah,
hopping.
that's impressive, Lilia.
That is.
Very impressive.
Yes.
That is impressive. All right, guys. Hey, Cardinal Recon, if you need more information, reach out to your rep, or you can get online. Is it just we're at on Cardinal's website? Or
You
how
can
do they
just
get a
Google.
hold? Just Google it?
Yeah, Google
All right,
Cardinal
Google it.
Reconciliation Service.
Yeah,
Yep.
and get a hold of them. Highly recommend
Yeah,
everybody
you can
sign
reach
up.
out to your sales rep.
Yep, sales rep can forward you exactly where you need to go on that for sure. All right, guys, thank you all so much. Interesting pod, and one that we all must do, right?
Awesome.
Yep.
All right,
Thank
guys,
you.
thanks.
Thank
Have a
you.
great day.
So I have a super interesting podcast that I'm doing right now where I actually am not moderating whatsoever, which is unusual and might be a good thing where I get a break, right?
Maybe.
But I have four lovely ladies in here today to talk about something that I believe as a Cardinal member, a Cardinal store, that every store needs to really take a hard look into, and that's RCS. So ladies, have at it.
Thank you, Adam. My name's Betsy Hurst, and I am a pharmacist on the RCS, and let's define RCS. We use a lot of initials around here. Reimbursement Consulting Services Solution at Cardinal Health, and I am sitting at this table with three lovely ladies. I have Lisa Kemp, who is the senior manager of our solution. I have Melissa Putnam, who is a pharmacist on the team and a former pharmacy owner, to share her perspective, and a really special guest. We have Miss Kristen Glesman with us today, who is owner of the Medicine Shop in Denison and Sherman, Texas. Thank you, ladies.
Well, thank you. I'm happy to be here.
Yeah, well,
Thanks for having us.
I was so thrilled to see you yesterday, Kristen, on the peer innovation panel.
That was the first time for me to do anything like that, and I learned so much from the other two pharmacists that were on stage with me talking, but it was just an incredible experience.
Well, you are doing a great job in your pharmacies, and I love the farmers market.
Oh, thank you.
I thought that was great.
I love that too.
And we learned the new word. Let me think.
Oh, that's right. Cosmeceuticals.
Cosmeceuticals.
Yes. Yeah.
That's a whole podcast in
It
itself.
is. It is. Yes. Well, that is
Launching
awesome.
a series.
Yes. Well, you're doing a fabulous job, and I know the pharmacy that I used to work in. I was just thinking about the honey. You're selling the honey in your farmers market, PHAR.
That's right,
MER.
PH.
That would fly off the shelves where I used to work.
We
So
sold
that's
Chow
awesome.
Chow,
Oh,
which
Chow
is
Chow.
a southern. Yes.
Oh, I think I've heard of that.
Yeah.
I mean, I'm in Texas,
Yeah.
but a little bit different part of the South.
Well, that's awesome. Well, we're here today to talk about our solution, which is the Reimbursement Consulting Services. So why don't we just start off, like Lisa, can you just tell us, just give everybody who's not aware of what the solution offers, just kind of a high-level overview of our solution.
Sure, Betsy, thanks. So RCS is Reimbursement Consulting Services. We like our acronyms here at Cardinal. It's a technology solution that lives in the Outcomes platform, and it brings together clinical opportunities along with financial and audit risk mitigation, as well as some insightful business reporting. The program itself is very dedicated and results-driven support. We have a biweekly advisor call. You will get an advisor assigned to your store that will call you at a biweekly scheduled call. It's a mutually agreed upon time. We currently have about 2,700 pharmacies on our solution. The stores that are on our solution are part of a very high-power network that has been part of the #1 performing PSAO within Outcomes for 4 years running. And right before I left to come here to Denver, we did find out that we are still #1 halfway through 2025. So we're well on our way to securing the spot 5 years in a row.
That's awesome.
Awesome. I feel like personally the hallmark of our service and our solution is the advisor. That advisor is such a special relationship. Kristen, do you tell us a little bit about how that works in your store?
Yeah, so I almost feel like I have biweekly calls, and I almost feel like I know my advisor. She's fabulous. we always chit chat just a little bit, and then we get into business. And so it's definitely comforting to have that relationship, because it definitely feels like, and she is looking out for our best interest. She goes over the reports, points out important things we need to look at, reminds me I need to get on the outcomes and not to forget to complete certain tasks before a deadline. So I feel like my little angel on my shoulder, like reminding me the important things, and definitely pointing out important audit risk,
Exactly.
things that could be detrimental to the pharmacy. She helps save us.
I agree that you really have a relationship with that advisor. We had RCS in our store for 17 years, and we had the same advisor that entire time.
Yes.
And so you felt like you knew that person when they called.
That's right. And I haven't met her in person. I missed her at RBC a few years ago. So I'm looking forward to one day actually meeting her in person.
Yes, she would love to meet you as well.
Yes.
I'm sure. Now, has she been helpful with you as far as helping you identify some easy tips or opportunities on the Equip and Outcomes platform as well?
Oh, yes. I mean, if you using Outcomes, there's definitely just easy little tips that, only take a few seconds or a few minutes, a little quick phone call with a patient that can be done quickly. My struggle is I'm a pharmacy owner of 2 pharmacies. I just put other tasks in front of it and forget how time. It's time. So it's really nice to have that bi-weekly call and have her just remind me, hey, especially at the end of quarter, hey, this is coming due. There's profit involved with it too. Like if you get this done, there's money on the table. And so I'm like, oh, thank you. I forgot. It's the end of a quarter. I need to hurry up and get this done.
It is funny how end of quarter comes a lot faster than you think it's going to come.
It happens. Yeah, it feels like every month there's an end of quarter.
But Kristen, I know you do a really good job of using your tech help and Outcomes, and also your students. So
yes.
I know that you do a really good job of that and using that time.
Yes. We have pharmacy students that come to us from Texas Tech Pharmacy School, and I usually have them champion MTMs. I mean, something I wish I learned in school. I think MTMs were just starting to become a thing in our industry, and so I didn't really understand it when I first became a pharmacist. So I let the pharmacy students champion it, and then they always have a call with Melissa, and Melissa trains them how to properly use Outcomes and how to understand how to use it, because it is, it's a new technology if you've never seen it. Mm-hmm. So Melissa makes it easy for the students to understand it, and it gives them a great opportunity to work clinically with our patients.
Absolutely.
Yeah, and so Melissa's part of the RCS team, so she's helping with that as well. That's awesome. Well, let's take a deeper dive into the reports, because I know we talked about that briefly, and that's like another segment of our solution. But we're really excited to announce that this RCS solution has launched a new report in the past 6 weeks called the Negative Receivables Report. Lisa, can you just talk us through this new report and kind of the thought process that we had at Cardinal before developing this report?
Absolutely. So it's called our Negative Receivables Report, and we talk to our pharmacies all the time, and we're always willing to listen to what their current pain points are. And one theme kept coming up, and it was about the claims that have a negative reimbursement amount coming from the PBM. So we took a deeper dive into, can we identify these claims? And if we can identify them, what information would be important to provide this? So we came out with this report, and it really creates an awareness of where money is being taken away from reimbursement. PBMs are using the contracted rate, which always uses the lesser of logic. So if you have your usual and customary price set below the contracted rate, you're going to get paid at usual and customary. Well, the new wrinkle that they've added to this is now that the PBMs are shopping the cash discount market. So instead of the contracted rate being kicked in, they're shopping the cash discount market. And if there's an opportunity to reimburse a claim with that, that's what they're doing. So it basically results in, the patient paying a copay, and then the plan taking some of that copay away, and you're left with a claim that could be, below cost. So it was a big frustration for our stores because it was happening seamlessly behind the scenes, and they weren't able to make a different decision with the prescription.
Have you found this to be a useful report to you, Kristen?
honestly, I utilize all the reports.
Yeah.
But there's definitely there's money left on the table if you don't look at those reports and utilize them and just take advantage.
Just the visibility, I think, that these reports are now showing.
Definitely visibility. Like most pharmacy owners aren't always in the pharmacy all the time, and I own 2 stores, so after we bought our second store, I had to step back from being in the pharmacy, and so I think that's when we've always used RCS, but I think that's when it really highlighted how important those reports are to me. So just make sure I know what's going on in the stores and make sure we stay on right track.
And that has to be hard to not be on site at all times and wondering what's happening. So it is great to have the reporting.
Yes.
To provide that information.
I feel like we would have really been able to use the negative receivables report when I was in the store, because it's hard to look just on a timeline. It's hard to look at every claims adjudication and make sure that you got paid, to cover your cost and things like that. Especially if you're going to seek adjudication out, you tend to look at the big hitters, right? You tend to look at your GLP-1s and your Genevias and things like that. You don't look at every claims adjudication. And so this report, I think, would have been helpful to me to see when you were having that negative plan paid amount.
Right. Yeah. And like Melissa was saying, right. So checking as a pharmacist, my attention is definitely on those brand name drugs, but this is happening for, just inexpensive generics.
Exactly.
And so you could be missing
Those are
a
easy
large
to miss.
sum of money, because you're focused on the prescription and you don't think about looking at the reimbursement those less expensive
on the
generics.
Triamcinolones and the
Right.
And
things
you
like
have
that.
multiple people entering prescriptions in the pharmacy, right? It's not always the same person.
Right. So, we try to train our technicians to watch for that, but we're also busy. The phone rings and you might miss the adjudication come through. So it's nice to catch it on the back end.
Exactly.
Yeah, that's a good way to think about it. Well, we also have other financial and audit reports that are visible on our solution. One we categorize as opportunity reports. So Lisa, can you just talk a little bit about what these opportunity reports are and kind of just high level what they illustrate to the pharmacies?
Yes. So our category of opportunity reports are prescriptions. If you think of any of them showing up on these reports, are things that you can take action on. So I used the example of usual and customary pricing earlier and how important it is to make sure your usual and customary price is set high enough so that the contracted rate kicks in. So we do have one report that will highlight anything that was paid at your usual and customary. Another one that takes a look at potential billing errors. So there's different pack sizes that are involved, and if there is a incorrect quantity that was billed, that will affect your reimbursement, and it could be in a negative way. So we want to make sure that any prescription that is billed out is being billed with the correct quantity as well as the correct day supply. Rounding out our opportunity report section is a reverse and rebill report. So the reverse and rebill report highlights any prescription that has had a recent AWP change. There are 2 times a year in which AWP changes the most, January 1st and followed up by July 1st. So we just had the second one happening to us. So there could be several thousand that change at the beginning of the year, and about 1,000, about half of what they do in January happen in July. And there's a period of time where the plan might be reimbursing at the old rate. PBMs get the same information that we do. This AWP is going up on a certain date. We immediately let you know that this is happening. Well, the PBMs can be a little bit slow. They're not as incentivized to get that information into their system. So it could be anywhere from a couple days up to a couple weeks. And during that time, if you're filling a prescription, you could get reimbursed at the old rate. And again, it's going to negatively affect your reimbursement because you're already buying it at the higher rate.
Exactly. So Kristen, what are your thoughts on these reports? Do you have a favorite?
Well, I do have a favorite.
Okay.
Or the one way I at least utilize the most is the potential billing errors. I can't tell you how many times, usually it's a day supply issue. We just didn't calculate it correctly. The technicians just didn't put it in, or we didn't catch it when the pharmacist was looking at it. And so my advisor has pointed out many times, mostly day supply, or like you're talking about package size. Well, that doesn't come in that package size. Or my advisor will point out what typical dosing should be, and she's like, did you really mean to bill it that way? And oftentimes it's no. We just made a technical human error when billing it, that in the audit process, it would cost us hundreds, or a long run over time, the whole year, thousands of dollars if if my advisor Tiffany did not
Sure.
point that out to us.
And that's what we're trying to do, keep you audit ready.
Yes.
And have that every 2-week phone call so that when we do identify something for you, it's an actionable item, so you can actually do something about it.
Yes.
Right.
And there's one thing I want to mention. I know it's not a report, but my advisor always tells me when a brand is going generic.
Yes.
And
So important.
that has also saved us so many
agree.
times because
I agree. You don't know.
We don't know
if you don't know.
We
I
don't
agree.
know, and so we've missed DAW codes on that. And so she's also saved us in that sense.
Or you find out on the substitution report.
That's what I was just saying.
Oh yeah.
The substitution report is so
Yeah.
in
out
LA as
later.
well.
I didn't know that was generic.
Yeah. And sometimes it's not. It was just an easy fix from brand to generic. That it can be that, but sometimes it's using the proper DAW code for it as well.
Exactly.
That finding the right drug is the most important, and then billing it correctly as well too.
Well, and that leads us to the audit reports. We have that section of reports that we identify as audit reports. So Lisa, will you just explain kind of what those reports are to people that don't
Yeah,
have
absolutely.
RBCS?
We want, as part of our CS program, we want to make sure that you keep the money that you already have, and the PBMs are out there auditing in full force, whether they're doing invoice audits or desk audits or in-person audits, and we want to make sure that we're protecting your pharmacy and mitigating your exposure. So we have a couple reports that will help you with that. First is the DAW codes report. So anytime you use a DAW code other than 0, it potentially puts you at risk for an audit. So we talk a lot and educate the pharmacies and the stores in proper use of a DAW code, so you can make sure that you keep that money as well as it triggers the correct reimbursement. And probably the most used report out of our audits is the frequently audited items report. And this is really just a targeted list of drugs that are commonly audited by the PBMs. They're highlighted a lot by insulins, eye drops, inhalers. Those are probably your top 3 biggest categories of drugs to be audited. I'll add in there GLP-1s. I'll talk about topicals, expensive items. These are targets. The PBMs are going after something that's going to be a money maker for them. So if they can find you making a mistake on one of those products, it's going to be a big chargeback for your pharmacy, and it could be very detrimental for that.
What I love is that we're constantly adding to that frequently audited report. As we hear from our stores, what are you being audited? We pass that, to all the advisors, to our whole team, and then we try to reflect that in that frequently audited item report.
Yeah, and we just came out with a new one, our special audit report, as we called it. We have to come up with a snazzier name, but it's basically applying some logic onto the report, and it's help kind of bringing those needles in a haystack, kind of up towards the top, where we're looking at some beyond use states, and making sure that sometimes those things kind of get past you when you're calculating the prescription, to make sure that you're not using a bottle of insulin past the 28-day expiration.
You can have so many procedures in place at the time of input and fill, but you've got so many things on your mind, and audit's part of it.
And the phone ringing.
Yeah.
Don't forget the phone's ringing.
You're going to let some things pass by, and I think it's just nice to have to know that you're going to have the backup to catch it this way.
Yes, I can speak to that with our pharmacy specifically. Especially when Ozempic was first coming out, how many times we might have had the wrong day supply, and how many times our RCS advisor had caught that. Did you really mean to put this or this? And I was like, oh my gosh, again, Ozempic's expensive, so saved us, thousands of dollars. And then we had a situation, which I recently learned about, eye drops not being 20 drops an ml. And I don't know how they do it. I haven't figured that out yet. But I think the RCS team had created an eye drop chart for pharmacies to use. And that has also been a lifesaver, because there was one time we billed a very expensive eye drop, thousands of dollars, that our advisor had caught, and educated me on how it's not always 20 drops. 20 drops in ml.
Absolutely.
Betsy and Melissa did a really nice job putting that together. They took apart all the different PBMs and manuals that are out there, instead of having to refer to all of them, and put it in one easy-to-use format. And we've been using it with our stores, and I'm glad you're finding good use in it.
It's nice to hear that you're using it.
Yeah.
Thank you.
Yes, we have it posted right by the pharmacist station, so everyone knows about it.
Good.
Yeah,
That's awesome. That's awesome. Well, there's also several other, I would call them informational reports, available on our solution. Lisa, you want to just share with us a little bit about maybe the third-party overview and some of the sub-financial reports that are also available?
Yeah, absolutely. So our third-party overview is really giving you a snapshot of your business, for a current month. It's typically looked at a month. We can also provide the information quarterly or annually, but gives you a snapshot of the PBMs that you're billing. One of the most important features on there is taking a look at what percentage each plan is of your total book of business. And that's very important, especially when different contracted rates change. I know there was something that happened a couple years ago with Express Scripts, and we really needed to level set the pharmacy's expectations when looking at that, like how many prescriptions or what percentage of their business were going to be affected negatively by that. So it does really help to give that visibility and giving just that list of what am I billing, how many different PBMs are out there, and breaking apart the business by brand and generic and overall gross margin and gross profitability is very important to take a look at it. So we not only have that available in like a PDF or an Excel format so you can kind of slice and dice, but it also gives you your top plans that you're billing. So knowing who's your top plan that you're billing, your top Medicare plans that you're billing, how much cash business if it's there, and who are your lower performers as well. But we also take that information and we give you in a visualized chart format that's very flexible. So a pharmacy owner can get in there on a daily basis and kind of check to see where their pharmacies is trending. We can take a look at current time frames, this time frame versus a previous time frame. So it really does give you a sense of what's happening in your pharmacy and looking at some of those key performance indicators.
Yes. Have you found those to be useful reports for use?
Yes, especially during when it's coming, like she was saying, open enrollment.
Yes.
It's probably that's one of the biggest times I really sit down and focus on those reports, but definitely gives a lot of visibility to our community, who we're filling for, and what insurance we're taking. So it definitely highlights what we need to pay attention to and if what contracts we need to maybe rethink.
Yeah. I think third-party overview is helpful because it lets you, sometimes you see your loss at adjudication and you get it in your head and you focus on the losses, like you think in your head, every time I fill Janumet to this PBM, I lose $50, right? And that's so stuck in your head. And it's nice to be able to step back and take a deep breath and look at the third-party overview and realize that bin is really a successful bin overall for you. Yes. You've been focusing on those losses that you see, but overall the bin's successful for you. Or maybe you look in there and you say, oh, you know what? This bin's only 2% of my whole business. So it helps you step back and take a breath. And
Exactly. Exactly. Well, we've talked about how important that advisor relationship is with stores, and that is, again, a key component to our solution. We've looked at our reports, but like Lisa, when you're talking to stores, what do you think are their best practices in order for them to get the most out of our solution?
Well, I think the engagement with the advisor is extremely important. We assign one advisor to the store for a reason. We want to make sure that advisor does get to know the owner and the staff at the pharmacy, because each store is unique. It's not a cookie cutter, and our reporting is basic and it has the same reports for each of our stores, but things are more important to certain stores than other stores, so we want to make sure that there's that engagement and that relationship is being built between them. So we want to make sure that there's a good mutually agreed upon time and that we're sticking to the schedule so that we can be respectful of each other's schedules as well.
Yeah, I agree. I feel like this solution is just so beneficial for independent pharmacists. When we were in the store, I don't know how we could have done the things we did without our advisor calling us back in the day. But I know you feel the same way about Tiffany as well.
Yes, for RCS, I think comes to mind two major things. Definitely visibility, especially as an owner, just staying on top of what's going on in the pharmacy with RCS providing those reports. And like I mentioned earlier, I appreciate those phone calls because I can have the discussion. If I just look at the reports, I might not necessarily notice something that should be looked at or highlighted. And so it's really nice when when Tiffany calls and says, hey, you need look at this. Have you noticed this or seen this? So it's just, she's kind of my partner in crime and looking at independent.
Another set of eyes to go over everything.
Your eyes and ears in your absence, like you said, the multiple
insurance
stores.
Policy. Yeah. Just another, an insurance policy for what you're doing.
Pharmacy's always changing and in so many different ways, and so it's hard to keep up with all those changes. So it's definitely nice to have those discussions. And then financially, I can't, highlight how important it is financially, how many times I've been saved with audit risk too, how important it is, how how the service pays for itself.
Yeah, exactly. Well, thank you for.
I was going to talk about the scorecard too.
Oh yeah.
So one of the newest things that we launched last year was our RCS scorecard, and this was really designed for owners. Our program is very flexible. Sometimes the owner takes the call, and sometimes we're talking to the pharmacist in charge or a technician. It just depends on what's being discussed.
Multiple people.
Sometimes multiple people, yeah. Sometimes we're talking to 2 or 3 people. So this is a way for us to stay more connected with the owners and providing an ROI of the solution themselves. So Kristen mentioned, taking advantage of some of the financial opportunities, but the audit as well, and really looking at how much money was saved and what we protected the exposure from an audit. And really seeing kind of that in black and white is great. Part of that we ask our advisors to kind of jot down when they find a big win, and big wins we have identified as something over $50. Most of the things we find out in reports are much less, but those big wins are important to kind of understand what drugs are being billed with a mistake, and it creates a way for the owner to have a checklist to train their staff and give them some best practices and kind of some things to look at. There's so many different things that you need to pay attention to at the pharmacy. So we're trying to create help and save you some time, and kind of pulling all this reporting together, as well as the outcomes reporting, which is going to show you, how your store is performing. Outcomes gives performance scores, 3 being an average store, and the higher your score, going up to 5, really means the more money that's coming into your pharmacy from a revenue standpoint beyond the script. So that in reporting coming from outcomes as well is important to see what you've taken advantage of and maybe what has been left on the table, and kind of discussing a game plan with your advisor as to what maybe can be done to try to get some of that additional money the next year as well.
Yeah, and we encourage anyone who would like to learn more about our solution to sign up for a demo. We'd love to show it to you, talk to you a little bit more in detail about how it can be beneficial to your store.
Absolutely, yeah. We're located in the financial health section of RCS, of the Cardinal Health RBC show. We're offering a show special of $75 off a month for the first year if you sign up at RBC, so that show special is running out shortly. We have a very talented team of advisors, 22 people across the country that will be assigned to your store to help you with your business. And we have 2 very talented clinical pharmacists can then help train your staff as well as yourself to make sure that you're really taking advantage of everything that the Outcomes platform has to offer as well.
Great. Well, this was awesome discussion, guys. I'm glad we could sit here and share what we do on a day-to-day basis with everyone, and I hope everyone has a better understanding of all the different aspects of our solution. Thank you, Kristen, for your time today and for sharing your experiences, and Melissa and for Lisa for breaking it all down for us today. We appreciate you talking to us today, and be with us, and have a great rest of RBC 2025.
Thanks. All right.
Thank you.
Thanks, guys.
All right, last podcast of the day. And I'm excited about this one because it's fairly new. We talked about it last year. Platform that Cardinal's rolling out, Vantus HQ. I have 3 lovely ladies here with me today. Addie, Morgan, and Melissa. And we're going to talk about Vantus, what it is, why we should love it, what it's going to look like, what it does look like, all the good stuff, right? All right, ladies, let's dive into it. So, one, I see Vantus everywhere here on the floor, right? Last year, we were kind of rumbling. We did a podcast about it, and then we did a slow rollout, and now it's here. So who wants to chime in? Tell me what Vantus is. Tell all the people out there in podcast land what Vantus is.
Yeah, sure. So Vantus HQ is our new ordering platform. We recently went live for all of our retail independent customers, but it's actually a lot more than just an ordering platform. It's really a hub for all of your interactions with Cardinal Health. It's a place where you can go to find industry updates, product information, and advanced analytics, as well as all of the information about your solutions.
That is something that I have noticed with Vantus coming from the old platform, is it is way easier to find things. There's still some things that need to be tweaking, and I know you guys are doing that, and we'll talk about that later, but it is a lot easier for sure on that.
Well, obviously, we're happy to hear that.
Yeah. I know. For all you podcast people, I said, hey, let's talk about this. She's like, well, I want to ask you a question first. And I'm like, nope, we're doing it on the podcast because it's real. That's what we're talking about, right? What else about Vantus? I know, is there an app for that?
There is a Vantus app. It's available for Android and iOS devices, both mobile and tablet. it syncs with the desktop site. So you can switch between your devices pretty seamlessly and continue working, in a fast-paced environment where you need to kind of shift gears. You're able to do that pretty easily.
I know with the old Order Express app, it was kind of clunky a little bit. This one seems a lot smoother. We're using it at our stores, so I'm happy about that. For you guys to know that, right? So it's two positives right there off the bat, right? All right, so Vantus, what does that even mean? Well, why did y'all come up with Vantus? Order Express kind of seems like normal. Why Vantus HQ? What is that?
Sure. So I think anytime you go to name something, there's a story, right? So when we started talking about what Vantus would be called, we wanted to make sure that we picked a name that was easy to pronounce. That was really important at the top of our priority list. Easy to pronounce, easy to remember, and really encompasses everything that Vantus HQ has to offer. So naming the site was really a group effort. We had suggestions coming in from across Cardinal, across the Vantus team, and we also took customer feedback on the name. And so what Vantus is a conglomeration of the words.
That's a big word. I'm glad it wasn't Conglomeration HQ and it's Vantus HQ.
Yes. So it's a mix of two words. Vantage, meaning view.
Got it.
And us, which really is to symbolize the partnership between Cardinal Health and our customers.
Nice.
So, we added HQ to really signify that it is kind of your home base, your digital hub for your interactions with Cardinal Health. So Vantus HQ is your full view into all of your services and solutions and ordering with Cardinal Health.
Yeah.
And it's your full headquarters.
Nice. And it is. I mean, it's way easier to navigate for sure. I had Order Express figured out. It only took me like 17 years to get it all figured out. And now we're switching to this new platform, but it has been very seamless. Like the education that you guys have sent out and the training videos. I haven't. Returns were a little funky because that whole process has changed, right, with the track and trace and all that stuff. But otherwise, it's been pretty fantastic. So, yeah. Why are you all surprised? Are you not getting that good feedback yet?
No, we've heard that from a lot of customers.
Yeah.
We've seen that where they're using the help section and they're utilizing any kind of information we have there. They're able to just quickly pick up and go and do things versus not needing a lot of guidance. And so that's been awesome to see.
Well,
I think it's less surprise and more excitement and pride. We've worked for a long time on this project, and to see customers have positive reactions it's so personal to us, and it's so exciting.
And also, I would just add, it's fun to hear you talk about things that when they work well, you just don't even typically notice them. Like if the navigation works well on a site, you probably wouldn't even notice that most of the time. So it's just fun to hear you call out some of the stuff that, we've touched.
Yeah. And you all mentioned it a while ago, like customer feedback. I'm glad that you asked us, and I think you're still asking
100%.
What's going on? What do you not like? There's some things I could tell you guys, hey, we need to work on this and tweak it, but it is important. So what is your all's process for getting customer feedback? If we have a Cardinal person listening and they're like, I really don't like that, what do they need to do?
Yeah, that's a really, really good question. I think, to your point, we did talk to customers all the way along. We've been gathering feedback all the way along, and now that we're launching and we're live, we're still gathering that feedback across a variety of different channels. So one thing that you can do if you want to give us feedback and you're here at RBC, we'd love to see you. We have a booth on the show floor. We also have the Learning Lab down in room 206. We'd be really happy to hear your feedback in either of those locations if you want to come talk to us live. You can also go to the on-site survey. It's on the Vantus website. We'd love to hear your feedback that way. And then, of course, you could also join our customer experience panel, which my team manages. And that's a great way if you want to kind of give ongoing feedback.
And honest feedback.
Honest feedback. Please. We want to hear it. Feedback helps us to improve.
Right.
So I know that sometimes people are uncomfortable about giving feedback, but we love to hear it.
Right.
Because that is going to
You don't have to be a turd when you tell them. But you
Be
can
nice about it, yeah.
Yeah, right. Be nice about the negativity.
But truly, like, it helps us to improve. It's going to help us to make enhancements as we go forward.
Yeah.
And one of the things, there's a couple areas we're actually getting feedback from. One is from sales team. We're meeting with them. We're meeting with SMEs as far as people who know certain features and functionalities of the site to get more information so that we can build it the right way. We're also we had the pilot in December when we first rolled it out. And we've gone into pharmacies to watch people use Vantus, which each major feature rollout, we will send a couple people there and spend 2 days to be like, how are you using this? And it's not just one particular feature. We want to see everything of what they're doing, where they may encounter some challenges versus where there is smoothness, because we want to eliminate that friction. The other thing we might do is just, like Addie was saying, spend time here at RBC with customers. I've had a lot of customers come up and they'll say, hey, I have some feedback. And we welcome feedback.
Yeah.
It's a gift to get that.
Yeah.
And we want to make improvements. We don't want to have this site become stale. We want to keep evolving it. We want to meet the customer where they're at.
And it needs to in the pharmacy world. It needs to constantly evolve. And that's something that a lot of programs that we use in the pharmacy world, they kind of fizzle out. They can't keep up. So I'm glad to hear that you guys are on top of that for sure. So when you say feedback, what's some of the good stuff you've heard about it?
Yeah, I'm so glad you asked that.
I did, because it told me right here to ask this question.
Well, I'm really excited to share with you. So to be honest with you, some of the simplest features are having the biggest impact, according to what our customers are telling us. So the navigation that you spoke about, the visibility to things on the homepage like order status and shipping status, having all of that information right in front of you when you sign in.
Yep.
Those are definitely things that we're getting positive feedback around. And I would be remiss if I did not mention the back button working.
Oh, the back button. Man, I was hoping you were going to say that was my biggest thing with Order Express. Well, two of them, the back button, and if you don't type it in exactly like it's in there. And now I don't. I can misspell stuff, and it's amazing, and I can find whatever, Schick Hydro razor something I need, like for a patient.
Yes.
Like, I was like, oh, about time. So that's good.
Yes. So you don't have to type it in exactly. You don't have to type in a SIN or an NDC or a UPC to find a product. You can search by generic name. You can search by a brand. Like you said, if you want to order something for maybe your front end, but you're not exactly sure what you want.
Right.
An example I use often is protein drink.
Yep.
There's so many brands, and maybe you're not sure. You kind of want to see what's available and price compare. You can just search for protein drink.
And if it
find
wasn't
all of
in
the
as
results.
protein drink on the Order Express, you could not find it. It
Exactly.
was a booger. Yeah.
Yeah.
So are you all, the buzzword now in America is AI.
Oh, yes. We have AI.
I love AI. Some people hate it. They think it's going to end the world, but I like when we can use it towards our advantage, right? So how are you all utilizing AI to improve Vantus for our customer experience?
The biggest one right now we're using it for is search. And we are actually in development to continue that enhancement of AI. So as you use search, it's learning and it's trying to continually evolve what it's bringing back.
Nice.
So the more that you use it, the smarter it's going to get. We have enhancements coming now. We have more enhancements coming in the future. The more people who are using it, the more we're going to see better results from.
Yeah. It's just going to keep snowballing on top of itself.
Yes.
Yeah.
So that is our biggest area that we are using AI in.
Nice. Yeah, I would love for it. Hey, you're looking this up, but what do you think about this, this, and this? And I know your store typically sells a lot of this, this, and this. And what do you think about this? And, that's something down the road that we can throw in there that would definitely help.
There's two other areas. Like, I know in Order Express, you might have searched for something and you'd be like, cannot find it. You get your empty results, try again, something like that. AI is helping us minimize that and find those results or bring back the relevant results. We're also working on recommended products so it can get smarter. And in the future, we're going to have it so, hey, it knows that you tend to click on this kind of stuff or you tend to order this. We should bubble that up as far as these are recommended products for you. So that's another area that we're looking at.
Nice. So on the flip side, what's the bad stuff? What are things that you're hearing from people that you're like, we got to work on that?
Yeah. So anytime you roll something new out, there are always going to be issues that arise. We did extensive research at the start of Vantus to try to understand what the ideal ordering experience looks like for customers. We work with prototypes in order to make sure that people were able to do most things. But there's always going to be something that, is an area that you need to enhance going forward. And so we're hearing a lot of those areas. The fun thing, well, maybe not a fun thing, but a good thing is that we're hearing a lot of the same stuff here at RBC that we've been hearing through the various channels that Melissa and I just talked about, from our customers, from our sales reps. And that helps us to understand that these are like larger issues that we really need to focus on and move forward with quickly. So one of those issues that we're hearing a lot about is scrolling in search results page.
Yes.
Yeah. You've noticed that?
Yeah.
Yeah. So that's something that we have slated for, we have a fix coming in a future enhancement that will be coming relatively soon. And it's something that we're also exploring other options for enhancements going forward with. But yeah, there are a few things like that we know we need to address. We're hearing that feedback. We're going to continue to gather that feedback from our customers so that we can keep improving.
And that's what I'm excited to hear. It goes in the next question is, this is constantly evolving.
Yes.
And you all have made that a point of this, whereas Order Express, you loved it and you hated it. It was easy to use, but at the same time, it was hard to use. Give us a little bit on how you guys are consistently going to keep it from getting stale and how it's going to evolve.
So Order Express is outdated. It's been in maintenance mode. It hasn't had a lot of love. And with Vantus, we are putting all our efforts behind that. We're using a multifaceted approach. We're taking feedback from our customer. We're looking at a 360-degree view of everything, what's coming up, other new technologies that maybe we might want to eventually incorporate. And we are just looking at qualitative information to continually improve. We have a goal that we want to be doing releases, multiple releases a year, whatever that looks like. I don't know if that's quarterly or whatever that could be. But part of those releases will be like bug fixes. Some of them will be enhancements, new features. So there's definitely the push behind what we want to do and meet the customer where they're at right now and also look to the future of what is available. Could there be more AI? Could there be other features and functionality that we haven't even imagined, or maybe it's just cutting edge that eventually we do roll into here. So
I'm glad, as an owner, I'm glad to hear that. I'm excited.
The nice other thing is we have a dedicated team. And we have a lot of people behind this, a lot of really great, passionate, smart people who are excited to work on this project and really want to make the best
I would say as an owner and somebody who uses Vantus every day, when you guys roll, and this is just me standing at your all's booth over here giving you some pointers, right? When you release a update, figure out a good way, and you may already have it, I don't know, to educate us on what that update is, even if it's a bug, right?
Yeah.
It's easy for me to see what that is and how to use it and so forth. Because I have a lot of programs that we use in the pharmacy world that gets updates all the time, and it's almost, you don't even know. And then you're like, you weren't using that service? I didn't even know it existed. So I'd make that a priority for sure.
Yeah, one of the things that we're kind of trying to leverage on this site as, we make fixes and also just to help as we're coming up with solutions is using those help and support articles.
Yep.
So that's a great place to go if you're ever struggling with something, just so you can kind of learn and you can continuously make sure that you're up to date on everything that is going on with Vantus in terms of what what you need to do or what you need to know. And then we're also using those alerts just to let people know when we do fix a bug, when there is, something that we're aware of, just so that we can make sure that people are able to continue to use the platform.
We also have a page on Vantus. We kind of refer to it as the Welcome Center as we're onboarding customers. It's still available. You can find it in the footer, and we link to it often for messages and alerts. And that's a place where we will put tips and tricks and mention those bug fixes or those new features and functionality. Right now, there's some videos out there on how to use some of the features that we know people aren't maximizing right now. And that's a place we do from there then link to our help and support library. But sometimes you don't want to have to comb through all those articles. You just really want, give me the highlights.
Right.
And so that's a great place to get those.
Yeah, when Vantus rolled out and we went live at all of our stores, that we trained on that. And if somebody comes in, it's a new hire, here, go to the Welcome Center, and you need to learn how to order and return and search and do all that stuff. So we have used that for sure. Now that Vantus is rolled out, you guys are getting feedback, you're getting a plan together on how to fix things and do stuff. What's some of the new things, even though it's so new that it rolled out, what's some new things that you're wanting to add or that's coming down the pike?
Yeah, so we have a lot of exciting things in the works. We have updates, what we call enhancements coming, some that have been planned. We knew we couldn't give everyone everything all at once.
Can't roll it all out at one time.
Right. So we've had some things planned that will be released as planned, but then we are kind of pivoting and adjusting and planning to roll out enhancements based on the feedback that we're hearing. So I can't speak to specifics, but
come on now.
What I can tell you is that, like Melissa said, we have a great team of really, really smart, dedicated, passionate people who work together to put plans together for these things. And we do so much work, discovery work is what we call it, into the scope of something and the impact it's going to have on customers, and make sure that we really understand what we're aiming for, and then we go into a building phase and a testing phase, because we don't want to put something out there until we know it works as expected. And so there's a lot happening behind the scenes, a lot to come that we're really excited about.
I'm excited. So one of the neat things when I do podcasts, I think I did it with you last year too, is you guys get to ask me questions. As a pharmacy owner, somebody's using Vantus, what is it that you wish you knew or would like to know more about, to pick my brain? And I know I'm putting you on the spot to ask questions.
What feature would you like that you don't have right now?
I don't know that there's a feature that I don't like that I don't have. I think my biggest thing with Vantus right now is the search is simple. It works, so that's good. The return on the search is a little clunky. I think we can clean up that view, like you were saying, the scrolling. And I've taught my team how to go in and customize the view on like what it is. But there's so many. You look at one drug and there's so many bits of information. What do you want to see? Do you want to see a picture? Do you not want to see a picture? And so trying for us to navigate what we like when our view comes up is something that we're working on. Returns aren't terrible with the QR codes and stuff. If it finds it, it's great. If it doesn't find it, that's hard. But that's something we're working on. I don't really know of a feature. What's a feature that somebody has told you guys that they wish that they had? Not to put you on the spot, but
so we're receiving. So receiving was something that was not, because we had so many things made the cut yet, but it is in the pipeline and we're working on it. And one of the things that they talked about was related to the DSCSA and the receiving, and how to kind of have some connection there as far as receiving.
And that's a whole nother, that DSCSA, like, I'll be honest, I've kind of just put it out of my, like, I've got other things to think about. I'll just wait on it. And I shouldn't be that way, but I'm being real. That's how it is.
That was actually my question, was How are you feeling with the DSCS, the changes that the DSCSA is bringing?
You know, when they had that first initial, it's going into effect, and before they put it off, like I was ready. Let's do this. We're going to get a company. Cardinal's ready. You know, I was going to do it. And then they put it off, and then I've had, personally for me, other things, I've kind of put it on the back burner. And I know there's some other pharmacists out there that are ready, and they're wanting to do it. I'm kind of letting you all lead that charge, right? I'm leaning on my team of people that I pay money to help me out do stuff, right? So, no, I wish I knew. I need to know more about it, in all transparency. But so maybe that's something, a training video on what it even is to help people. There's a lot of pharmacies that don't even have a clue what it is and how it's going to impact them. And of course, the big piece is, for me, was returns, and because we're not always buying everything from Cardinal, which I know Cardinal wants us to, but they're realistic. All my reps are, hey, we know you got to buy stuff from secondaries and so forth. So that's going to have a piece to do with it. All right, one more question.
So if you watched the customer panel this morning, the gentleman spoke about kind of leveling up his pharmacy techs. And that's something that we really hope that Vantus can help with, because we're giving so much information kind of when and where it's needed to make decisions and be able to compare products and know, what the right choice is. So I guess my question for you is, have you seen that? Do you feel like it's kind of helping people make better decisions, or maybe make faster decisions?
Did you do your research on who I am before you came in here? You didn't? Oh my gosh, come on. My jam is workflow and team efficiency. And so my team, not tooting my own horn here, they do it. I don't even have to be there. So my team, and that's why one of the reasons I do this podcast is I like to help stores with workflow and efficiency and getting their team up to where the owner can work on the business instead of in the pharmacy, right? And I wasn't trying to be facetious a while ago. I was just playing with you. But yes, that is super important. The more your team can do and take things off your plate, the more I can, as a pharmacist or an owner, do higher quality things, correct? So I have been in numerous pharmacies where the pharmacist / owner is the one who does the ordering and checks the order, and because he doesn't or she doesn't want to delegate, right? And so if anybody's listening to this now, one, Vantus is easy. Yes, there's some things that are going to get tweaked, and that's what we talked about. And you guys are on top of that, which I'm super excited about. But it's easy, and it's easy to hand off and to trust your team because it's got tracking, it's got reports, it's got all these things, right? So that is extremely important. It's a fantastic place to start a technician that you're like, all right, you're over ordering now, you're over returns, you're over whatever it is. And this system, I think Order Express was okay. Vantus is way better for making that easier for those technicians, for sure.
Yeah,
so
that's great to hear.
I made y'all smile. Okay, so I'm excited. Vantus HQ is officially rolled out. A month or so ago when you went full with everybody that is on board. Last year we thought it was going to be a little sooner, but it's okay. But now it's out, it's working, it's fantastic. If you have questions, go to the Vantus booth, ask your rep. You can get online and call. Anything you can send in the request online. They need your feedback because they're constantly tweaking it. This team, it's one thing I can say about Cardinal Health. As long as I've been with Cardinal Health and starting to learn each team, all of your all's teams are pretty tight. You all, really focus in on what you're doing. And I'm not just saying that because they're having me here to do that. All my Cardinal people have always been fantastic. That's why I'm hanging out with them. So Vantus HQ. Anything else, ladies, that you want to throw in there?
No, just thank you for having us.
Well, yeah. See, it wasn't hard, was it? No. Podcasting's easy. Right? Anybody can do it.
We're excited to be, part of this, and we just want to help the customer along. So.
Yeah, and it's going to do it. So, guys, I'm signing off. Ladies, thank you all so much. If you have any questions about Vantus HQ, just jump online or ask your rep. Have a good one.
Thank you.
Thank you.